Today, we are going to learn bevacizumab using a powerful visual story mnemonic called the Vase. Bevacizumab is a monoclonal antibody drug that targets VEGF, which stands for vascular endothelial growth factor. VEGF is extremely important for angiogenesis, meaning the formation of new blood vessels. Tumors require blood vessels for oxygen and nutrient supply, so many cancers produce VEGF to stimulate abnormal vessel growth. Bevacizumab works by blocking VEGF and thereby inhibiting angiogenesis. This image converts all of those pharmacology concepts and side effects into a memorable visual story that is easy to recall during exams and clinical practice. Imagine entering a greenhouse where there is a large decorative vase placed at the center. Around this vase, multiple bees are swarming aggressively. Immediately, the bees and the vase together create the phonetic clue Vase, which directly reminds us of bevacizumab. The bees in this scene are not randomly flying. They are specifically attracted to a special flower nectar labeled VEGF nectar. This is the most important mechanism in the entire story. The bees binding to the VEGF nectar symbolize bevacizumab binding to VEGF. Since bevacizumab is an anti-VEGF monoclonal antibody, the bees attaching to the nectar represent the drug neutralizing VEGF activity before it can stimulate blood vessel formation. This is the core mechanism of action of bevacizumab and the central concept that should immediately come to mind whenever you see this image. Now look closely at the vase itself. The blood vessel stems around the vase are beginning to wither and dry out. This represents inhibition of angiogenesis. Normally, VEGF promotes growth of new blood vessels, especially within tumors. But when bevacizumab blocks VEGF, angiogenesis is suppressed, meaning tumors lose their blood supply and cannot grow effectively. That is why bevacizumab is used in various cancers, including colorectal cancer, renal cell carcinoma, glioblastoma, cervical cancer, and some lung cancers. So the dying vascular branches in this image symbolize starvation of tumor blood supply through anti-angiogenic therapy. Now shifting our attention toward the left side of the image, we notice a pressure gauge showing extremely high pressure, clearly labeled hypertension. This is one of the most important and common side effects of bevacizumab. VEGF normally helps maintain vascular relaxation through nitric oxide pathways. When VEGF is inhibited, blood vessels become more constricted, increasing systemic vascular resistance and causing hypertension. So this large high-pressure gauge serves as a direct visual clue for one of the highest-yield adverse effects of bevacizumab therapy. In clinical practice, patients receiving bevacizumab require regular blood pressure monitoring because severe hypertension can develop during treatment. Next, look near the bottom of the image where we see a kidney beside spilled protein fluid on the floor. This scene represents proteinuria, another important side effect of bevacizumab. VEGF is important for maintaining glomerular endothelial integrity inside the kidneys. When VEGF signaling is inhibited, glomerular damage can occur, leading to leakage of protein into urine. The spilled protein near the kidney therefore acts as a visual cue for proteinuria. In some patients, this may progress to nephrotic range protein loss or renal dysfunction, so urine protein monitoring becomes important during therapy. Now moving toward the center and lower region of the image, we can see areas of bleeding around damaged vessels and the floor stained with blood. These red hemorrhagic patches symbolize bleeding complications associated with bevacizumab. Because VEGF inhibition affects vascular repair and endothelial integrity, patients become more susceptible to bleeding and hemorrhage. This can range from mild epistaxis to severe gastrointestinal or pulmonary hemorrhage, depending on the clinical setting. Therefore, whenever you think of bevacizumab, remember the risk of hemorrhage and bleeding tendencies represented by these blood-stained areas around the vase. One of the most dangerous complications is illustrated on the right side of the image. We see a damaged model of the colon with a large hole through it. This represents gastrointestinal perforation, which is a serious and potentially life-threatening adverse effect of bevacizumab. Since VEGF plays a role in tissue healing and vascular maintenance, Inhibition of VEGF can weaken bowel integrity and impair repair mechanisms, occasionally leading to perforation of the gastrointestinal tract. Although relatively uncommon, this is considered one of the most feared complications because it may require emergency surgery and carries significant mortality risk. The torn colon in this mnemonic is therefore an extremely high-yield visual clue for GI perforation associated with bevacizumab therapy. Now observe another subtle but important finding in the image. There are broken wounds and healing bandages around the scene, symbolizing impaired wound healing. VEGF is essential for angiogenesis during tissue repair and surgical healing. When VEGF is blocked, wound healing becomes delayed or impaired. That is why bevacizumab is often stopped before major surgeries and restarted only after adequate postoperative healing has occurred. Clinically, this is very important because surgical complications increase significantly if patients receive bevacizumab too close to operative procedures. The image also subtly reminds us that bevacizumab is a monoclonal antibody drug because many Bs carry labels such as MOB, reinforcing the monoclonal antibody concept. This is another high-yield pharmacology point because most drugs ending with MAB are monoclonal antibodies. So the Bs not only create the phonetic anchor for bevacizumab, but also reinforce its biologic drug classification. Putting the entire story together, this mnemonic becomes extremely powerful for rapid recall. The Vase immediately reminds us of bevacizumab. The B's binding to VEGF nectar represent anti-VEGF monoclonal antibody activity. The withering blood vessel stems symbolize inhibition of angiogenesis. The high-pressure gauge reminds us of hypertension. The spilled protein near the kidney indicates proteinuria. The bleeding patches represent hemorrhage risk. The torn colon symbolizes gastrointestinal perforation, and the broken wounds indicate impaired wound healing. Every single object in this scene translates directly into an important pharmacology fact or adverse effect. So to summarize, bevacizumab is an anti-VEGF monoclonal antibody that inhibits angiogenesis and is used in several cancers to reduce tumor blood supply. Important adverse effects include hypertension, proteinuria, bleeding, gastrointestinal perforation, and impaired wound healing. By visualizing this Vase story mnemonic, you can rapidly recall both the mechanism of action and the major side effects of bevacizumab in a memorable and exam-focused way.